Hello to everyone listening. My name is Yasmin, and this is our second year community report for which we've explored the work of Cafe Leep in Leeds and the positive impact which their work has had on our community. So Cafe Leep is a branch of Leap One, a self-advocacy group for adults with a learning disability. The cafe was created in 2015 in response to Leap One members who wanted more opportunities in terms of employment. As an approved Highfield Training Centre, the cafe provides a training scheme for adults with learning disabilities who wish to work in catering. Training will involve helping to run the cafe while studying for a level 2 NVQ in food safety. It is an opportunity that allows individuals to further develop their self-confidence, organizing skills, money handling experience, and ultimately to improve their level of independence. The cafe will also support trainees to secure paid employment when they feel ready to leave, ensuring that they achieve the same opportunities and pay as their colleagues. Financially, the cafe is very separate from Leap One, with funding obtained through both cafe sales and Leeds City Council, who also fund the NVQ trainees as part of their adult social care plan. During the pandemic, the cafe also received funds from the National Lottery Community Fund in order to make ends meet. And now I'm going to pass on to Lizzie.
Susan Hanley acts as Chief Executive of Leap One, and she created Cafe Leap in order to provide more pathways into employment for people with a disability. Susan's passion for ensuring equal opportunities for people with a learning disability is inspirational, and as a woman with Down syndrome, she has overcome all stereotypes to play an integral role in leading improvement and challenging prejudice within our community. The cafe itself is managed by Angie Marshall and assistant manager Darren Nixon. There are also 3 part-time cafe support workers who ensure that business runs smoothly while supporting new trainees. The partnership working demonstrated by Cafe Leap can act as a model example for other organisations, particularly in healthcare, as their cooperation with local businesses allows continuity of support for those at the end of their training, but also allows the cafe to host events which are relevant to service users and their families. As an example, the cafe invited local GPs and nurses to discuss the importance of COVID vaccines for clinically vulnerable individuals and how to stay safe during the pandemic. I'm now going to pass on to Chloe.
So, as discussed previously, Cafe Leap supports adults with a learning disability, particularly in relation to employability, as they aim to tackle social inequalities such as poorer job prospects due to underestimation by employers and social exclusion within the workplace. In our discussions with cafe staff, we were really shocked to hear that these inequalities are actually experienced quite frequently, with one member highlighting how some employers believe that a cooked meal is satisfactory payment for a full evening of work, and how adults with learning disabilities are often excluded from social gatherings. Sadly, these inequalities are reflected in our healthcare systems, as adults with a learning disability are often excluded from discussions about their personal care plans, with medical professionals overlooking their presence to converse with social workers instead of the patient. It was also highlighted to us that in a medical environment, doctors fail to adopt appropriate language and discussions with patients who have a learning disability, using medical terminology and failing to explain concepts in a manner which could be more widely understood. Although more could be done in terms of healthcare, Cafe Leap is a leading figure in accommodating social change, and their work has been recognised on national, local, but most importantly, personal levels. So in 2020, Cafe Leap was recognised nationally as a finalist in the Recruitment Industry Disability Initiative. And in 2017, they were crowned the Yorkshire and Humber winner in the Britain's Best Cafe competition. But more importantly than any culinary achievement is the acknowledgement which Cafe Leap receives from service users and their families. The success of the cafe's trainees is undeniable, as to date, not a single candidate has failed their NVQ exam, and a significant number of trainees have been successful in attaining paid work outside of the cafe. But for even those who don't want to gain further employment, their personal skills, their confidence and independence are a world away from the start of their journey at Cafe Leap. So I'll now pass on to Freya, who will talk about our reflections.
Visiting Cafe Leap gave us a lot to reflect upon, particularly in relation to communication skills. When speaking to members of the team at Cafe Leap, we were shocked to hear how often doctors chose to talk about adults with a learning disability instead of talking to them, and So we'll be ensuring that our future practice is inclusive and considerate by conversing with the patient instead of their social worker, and by including them in decisions about their healthcare plans. Another frequently mentioned point in relation to communication skills was the use of medical terminology in discussion rather than the adoption of appropriate language, which would not only be more suitable for adults with learning disabilities, but for any member of the public who had not undergone medical training or education. This is often discussed in our communication skill session acted as a reminder of how poor communication can damage rapport with patients. Finally, our visit to Cafe Leep allowed us to appreciate the importance of the voluntary sector in improving community well-being and advocating for the rights of people with a learning disability. As we were able to hear many touching stories about how Cafe Leep has improved the livelihoods of so many adults, that this highlights how good understanding of voluntary organisations within the community is vital for practicing doctors, as they may be able to pass their knowledge on to patients so they can be more active in supporting their own needs and well-being. Thank you for listening.